Are you transgender, female to male, female to whatever, or transmasculine? I know this is a difficult question which transgender people struggle to understand prior to transitioning. The reason for this struggle is often a lack of clear information available and sometimes denial on the part of the person who is transgender. There is a possibility that you are struggling with accepting you are transgender because you have repressed your gender identity for so long and you can no longer deny it. There are two specific qualities which transgender people have. In this video, I will cover one of these qualities. I will go over the other criteria in the next video. People who are transgender have something called dysphoria. Dysphoria is defined as a state of feeling unwell, which is confusing. My clients describe dysphoria as discomfort, pain, or just not feeling right. It varies from mild to extreme and typically centers around certain parts of the body commonly associated with being female. This dysphoria is associated with secondary sex characteristics, such as having breasts, a more curvaceous figure with a narrow waist and wider hips, a round face with soft features, and your current genitals. Think for a moment. Do these qualities in your body cause you pain, discomfort, or feel wrong to you? Remember, it can be mild to extreme. Then dysphoria can arise when people are perceived as female when they do not feel female. There are signs of this pain or dysphoria. It can be manifested with anxiety or depression and managed in actions which provide a temporary sense of numbing, like alcohol or drug use or cutting, and can even lead to thoughts of suicide or even attempts. People who are transgender use these coping mechanisms and are not aware in the moment that this behavior is connected to their dysphoria. It is only later that it makes sense to them that they were struggling with how their body was and how they were being perceived by others, that these were actually major contributors to their coping mechanism. While there are people who have depression or anxiety and people who struggle with cutting and addictions, and these people are not transgender, the difference is for the person who is transgender, these things tend to decrease after transitioning when the dysphoria decreases. Having this severe response to dysphoria is not a requirement to be transgender. Not everyone who is transgender identifies with intense dysphoria. Others feel poorly about their body and their gender, but it will not be nearly as evident. People like this come to understand that they are transgender by recognizing that they would feel better if their body was different and if they were not perceived as female. By the way, feeling better at just conceptualizing this change is evidence that you have dysphoria. It's just less obvious. An example to illustrate dysphoria that I frequently see in trans men is their efforts to hide their chest. They will wear a binder or sports bras and hunch their shoulders forward and then pull their shirt away from their body, especially when they sit. All of these behaviors create the appearance of a flat chest, and that appearance makes them more comfortable. This is a sign of dysphoria. To determine if you have dysphoria, I want to ask you a few questions. How do you feel about your body as it is? Does it feel uncomfortable, painful, or just not right? Imagine you could never change it. What feeling arises from this thought? That thought may actually intensify dysphoria. Next, imagine the alternative. Imagine your body differently, such as facial hair, body hair, sharper facial structure, broader shoulders and narrow hips, high muscle mass. Does imagining this provide a sense of relief? If the answer is yes, then you have dysphoria, which is the first criteria for being transgender. I hope this video provided some clarity for you. As I said in the beginning, there are two components to determining if you are transgender. Having dysphoria is the first criteria. Watch the next video to look for the second component. If you found this video helpful, then please remember to like, share, subscribe, and if you can afford to do so, make a donation to my student loans, which exceed $100,000. Thank you.